Let's be honest, we've all done it. You get a new symptom, type it into Google, and suddenly the internet convinces you it's something scary. Today, we're going deeper into what I call the Dr. Google dilemma: why we search, how misinformation spreads, and how AI and the digital NHS can help you find answers that are safe, reliable, and personalized. The internet has become our first waiting room. People Google symptoms because it's immediate, private, and available 24/7. But here's the catch: Google ranks results by popularity, not clinical relevance. When you type headache plus dizziness, Google doesn't know your age, medical history, medications, stress levels, or lifestyle. So it often pulls up rare but frightening diagnoses, triggering anxiety long before you speak to a professional. The real danger of online self diagnosis is that it becomes unsafe when you assume the worst case scenario. Follow advice from influencers, forums, or non medical websites. When you mix up symptoms that look similar, or ignore red flags because online advice said you're fine. One of the most common issues I see in clinic is delay in seeking help because someone trusted the wrong online source. And sometimes it's the opposite: extreme anxiety from reading online horror stories that don't apply to your case. How do we use online health information safely? The goal today isn't to stop people from searching, but to help them search well. Reliable sources in the UK include NHS.uk, which is evidence based and reviewed. We also have the NICE guidelines, and this is used by clinicians. Also, patients.info for information that have been clinically peer reviewed. When reading online, ask yourself: is this from a healthcare organization? Is the information up to date? Is the author medically qualified? Does it mention speak to your doctor? If any site that discourages seeing a clinician is an immediate red flag. These days, there's a rise of AI symptom tools. Is this a help or a hype? Artificial intelligence is becoming part of the NHS and healthcare globally, and in a safe and structured way. AI in healthcare doesn't diagnose you, it supports decision making. AI tools in the UK includes those behind the NHS 111 online and new digital triage systems, and they work by asking evidence-based questions, identifying red flags, assessing urgency, and guiding you to the safest service. The key advantage is that AI is consistent. It doesn't guess or panic, and it is essential to know that AI is always supervised by human clinicians. In my clinical governance work with digital health, we review safety testing, bias risks, data protection, and clinical oversight. The future is not Dr. Google, it's Doctor plus AI, a combination built on safety, accuracy, and personalization. How can clinicians work with patients' digital curiosity? Patients researching online is not the problem. The problem is when we don't support them to understand what they read. I always encourage people to bring their online questions to appointments. It helps create better conversations. The best healthcare happens when patients feel informed, not frightened, not dismissed, and not confused. Curiosity is a good thing. The internet is a powerful tool. AI is the future, but your clinician is still your safest guide. So next time you find yourself deep in a Google rabbit hole, pause, breathe, and remember, information is helpful only when it's accurate and personal to you. I'm Dr. Jide, helping you understand healthcare one conversation at a time. If this helped you, please like, share, and subscribe. Bye.